Good afternoon, everyone. Welcome to our weekly media information session. As Bill mentioned, my name is Natalie Bocking. I'm the Medical Officer of Health with Halliburton Kawartha Pine Ridge District Health Unit, and happy to provide some information today related to COVID-19 across the Northumberland County, Halliburton County, and City of Kawartha Lakes. So the format of my update will be similar to previous sessions. I'll start with a bit of a situation update with regards to the epidemiology or the numbers of COVID-19 across the region, some updates around vaccination, and some general comments about public health measures before an opportunity for questions and discussion. So certainly we're hearing the provincial message that the Omicron wave or number of infections seems to have peaked and could potentially be on a decline. I think historically, when we look at where HKPR sits within the province, we tend to be about a week behind when the province has peaked or overall provincial trends. I think that it's quite likely that we will have peaked around this week or just this past week. I think, though, what's important to remember is that we might have peaked, but we also seem to have plateaued a little bit. We are seeing a decrease in the number of new lab-confirmed infections that are being reported to the health unit every day. We've gone from over 100 new lab-confirmed infections to around 40 to 50 new lab-confirmed infections. Of course, we know that lab-confirmed infections don't actually represent all infections in the community because there are many people that right now don't have access or don't meet the eligibility criteria to access PCR or lab testing for COVID-19. Our test positivity rate has really stagnated or remained the same at around 12%, and it's been at around 12% for the last 3 weeks or so. Our outbreaks, our total number has declined. We're currently sitting at 15 outbreaks, or at least as of earlier this morning, we were at 15 outbreaks. 10 of those are in long-term care homes and retirement homes, and 5 of those are in other congregate settings. Of our total lab-confirmed cases, we have 307 across our whole region of active lab-confirmed cases. And currently 19 individuals that are admitted to hospital with COVID-19 and 6 that are currently in the ICU. With regards to wastewater surveillance, I spoke a little bit to this piece last week as it's a new component of our weekly EPI updates or reporting on the data associated with COVID-19. And we have 2 wastewater surveillance sites that are currently in operation. So one in Lindsay and the other in Cobourg. As I shared last week, the data, there's about a 7-day lag in between when the samples are taken and then when we actually receive the data or the notification. So the data that I have today is from January the 26th. So, and what we have seen is that increases or decreases or plateaus in the viral signal from the wastewater usually is usually about 6 to 7 days ahead of when we see changes in case counts up or down. What we saw really with the emergence of Omicron in both of those wastewater surveillance sites was a pretty steep increase in the viral signal coming out of those wastewater surveillance sites. Both of those sites, both the sites at Lindsay and Cobourg, had come down a little bit, and then both experienced an increase again, and then both were noted to start to come down again. Lindsay right now appeared to be, the data from last week appeared to be on a decline, whereas Cobourg had kind of plateaued, if not increasing slightly. Again, it's challenging for broader rural health units to utilize wastewater surveillance in the same way as some of our urban partners that really have the majority of the population that they serve in a larger urban area. But I think it is one piece of the puzzle when we're looking at the big picture of where we're heading. Despite the fact that our case numbers might be coming down a bit or plateauing. As you've likely heard from provincial media reports, we should expect to see ongoing hospital admissions and ICU admissions associated with COVID-19 for another couple of weeks. If we look at some of the characteristics of the number of infections that have resulted in severe disease with the Omicron wave, and we look back to January 1st, so really January 1st onwards for us being, this is a good reflective picture of what the Omicron variant has been doing across the community. And so since January 1st, we have had 50 new hospital admissions due to COVID-19 across all of HKPR, 13 ICU admissions, and 14 deaths. Among the individuals that are admitted to hospital, we still have the majority of individuals that are either unvaccinated or partially vaccinated. So 56% of those hospital admissions among those people that have not had any vaccination or only one dose. And then the remainder either having received 2 doses or a booster dose. With ICU admissions, the difference is even greater, with 61% of those individuals not having received a vaccination. There continues to be very good emerging data from not just Ontario numbers, but also jurisdictions in the United States, the United Kingdom, that demonstrate the added protective benefit of a booster dose of COVID-19 vaccine. And that continues to play a key role in helping to really blunt the impact of Omicron variant on our healthcare system. We're still hearing a number of questions from community members about why the total number of people that are vaccinated or unvaccinated seems to be the same among people that are admitted to hospital. And so I just wanted to share with folks on the call here today, and I'm hoping that you can pass it on, that a very good resource has been developed by the Eastern Ontario Health Unit. It's a video that walks through why we really can't talk about absolute numbers of vaccinated, unvaccinated, because that doesn't tell us really the true story among individuals admitted to hospital. What we really need to be talking about is the rate of infection or the risk of infection among people that are either not vaccinated or those that have received 2 doses or a booster dose. And so we will be putting that video up on our website, and I'm not sure if Bill will have the opportunity to put it in the chat today, but we thought it was a good depiction or description of how to look at it in terms of rate or risk as opposed to just absolute numbers. We do know that the risk factors that were previously identified in earlier waves of the pandemic that put somebody at a higher risk for a severe outcome from COVID-19 infection seem to be remaining the same with the Omicron variant. So risk factors such as older age, obesity, other medical conditions such as diabetes, chronic lung disease, other heart conditions, will put an individual at higher risk of having a severe illness related to COVID-19, including if they have received a 2 doses of vaccine or a booster dose. So those individuals that have had their booster dose that have been admitted to hospital or ICU, we tend to see that among individuals that are of kind of much older age cohorts in their 80s, 90s, and have other medical conditions that put them at higher risk. So I'll move on now to a couple of updates related to vaccination, and in particular related to booster doses. So as of January 31st, or Monday of this week, 83% of the population across HKPR jurisdiction that is age 70 and over had received their booster dose of vaccine. 70.3% age 50 and over had received their booster dose, and then 57.5% of the population aged 18 and over having received their booster doses. Certainly, I think this is a good sign, especially among the age cohorts that are older, that we're seeing quite high uptake of the booster dose. We are seeing, I think, a lower uptake now, and certainly a slowed uptake among the broader population that's age 18 and over. This could be for a number of reasons, and one of them I think I've certainly continued to hear is, well, you know, if even people that are vaccinated are getting sick, then why should I get a booster dose? Or really, we all should just get it, and so we don't need the vaccine. And in response to that, I does increase your protection significantly against severe illness associated with COVID-19. And every time we prevent someone from developing a severe infection from COVID-19 and needing to be admitted to the hospital, we are helping to alleviate the pressure on our hospitals to ensure that other ongoing healthcare needs are being met. Just this week, we know that the province has resumed some other elective surgeries, some other healthcare services that had put on hold as a result of the Omicron wave. And we certainly want to avoid as much as possible having to put procedures on hold or decreasing other services because there's already significant wait lists and catch up that is needed across our healthcare system. So those booster doses are important and make a difference. The other reason we might be seeing slightly lower uptake still is whether if people have actually had a recent COVID-19 infection. And our recommendations around getting your booster dose after you've had a COVID-19 infection, there's two things really to consider. So one is, when are you eligible to get the COVID-19 booster dose after infection? And then when is the optimal timing for immune response to get your booster dose after a COVID-19 infection? So with the first, people are eligible as soon as they're out of their isolation period and they're not having any symptoms. So they're essentially clinically well, they're feeling better. You're eligible, you can get that booster dose of COVID-19 after infection. It does seem that for optimal immune response, waiting 4 to 6 weeks does have some benefit so that your immune system will create more response at that time with that interval as opposed to receiving it right after infection. So should people come to our clinics and be asking for a booster dose after COVID-19 infection, we'll share this information. But we certainly know that because there has been a high number of infections in the community, there might be some individuals that are not yet getting their booster dose as they recently had COVID-19 infection. With regards to our pediatric population or kids, our coverage of first doses among 5 to 11-year-olds does continue to slowly increase. We're at 46.9% as of Monday this week. We are working with our school board partners to establish school-based clinics that will be starting, I believe, the week of February the 14th. My understanding is that consent forms have been sent home by our partner school boards, and our teams are working closely with the school boards to determine which schools those clinics will roll out in first. And really looking at those areas of the geography that of our geography where there has been challenges for families, perhaps in accessing vaccination at mass immunization clinics or pharmacies. So primarily targeting more rural areas and areas that have had lower vaccination uptake to date. For all of our other mass immunization clinics or health unit-led clinics, as of February the 7th, those clinics will be open for walk-ins for any age, any dose, and at any time of the day. Currently, they're open in the afternoon from 1 to 4:30 for walk-ins, but as of Monday, February 7th, it will be expanding further to essentially all clinic operational hours, so between 10 and 4:30 for walk-in appointments at health unit-led clinics starting on Monday. The only other recent announcement that has come through the National Advisory Committee on Immunization was an update on booster doses for 12 to 17-year-olds. We have seen in the United States that the FDA had approved booster doses for 12 to 17-year-olds, and different jurisdictions had started to roll out booster doses for broader population of 12 to 17-year-olds. So in Canada, NACI has indicated their recommendations that booster doses be made available to certain 12 to 17-year-olds that are at higher risk of severe COVID-19 illness. Now, they might be at higher risk because they have a certain medical condition, or they might be at higher risk because they live or reside in a setting that is at higher risk of COVID-19 outbreaks and severe outcomes. So within this NACI recommendations, they've listed the medical conditions that would put somebody at higher risk of developing severe illness, as well as those settings that would be considered at higher risk of spread and outbreak and poor outcomes associated with COVID-19 infection. They've also recommended for 12 to 17-year-olds that have moderate to severe immune compromising conditions that, similar to adults, they receive 3 doses as essentially their primary series. So they need 3 doses to essentially receive the same benefit as 2 doses in somebody with a normally functioning immune system. And then once they've received that 3 doses of a primary series, they would then be eligible for a booster dose. I did want to note that at this point in time, the NACI recommendation for booster doses for 12 to 17-year-olds that fit those criteria is currently recommended at 6 months after their second dose. However, we're still waiting to hear from the province of Ontario to determine what policy direction they will take to roll out and support booster doses for this age group. And we've certainly seen before where sometimes provinces make decisions to roll out at different intervals from the NACI statement, depending on the context of COVID-19 transmission at the time. So certainly when we have more information, we'll share that. Otherwise, I think I wanted to reinforce our continued public health messaging in general in the community. So we know that the province did ease some public health restrictions this week as we re-entered step 3 of the roadmap to reopen. I think we are provincially expecting, and I think locally we should expect also that with the easing of restrictions, we will see an increase in transmission, and it could lead to some ongoing hospital admissions. And with that, people need to continue to do their individual commitment to keeping our communities healthy as best as they can. And this includes continuing to wear masks in indoor public places, continuing to minimize social gatherings where we can, and continuing to respect the other public health restrictions and capacity limits that the province has in place. My understanding really at this point in time is that the easing of restrictions, while we are anticipating there to be an increase in infections, that the hospital system will be able to accommodate for that. But I think we will need to keep a very close eye on that, especially in our region, neighboring regions, in terms of what the impact will be. And as we continue to try and keep certainly our most vulnerable community members as well as we can. So otherwise, I will close with an unrelated COVID announcement, actually. I think that most people are likely or may not have heard that our current manager of communications and IT services is actually retiring this week. So Chandra Tremblay will be finishing her long extended career with the health unit, and we are wishing her all of the best of health and wellness and joy in her retirement activities, and thank her for her continued commitment and support over the many years. And we are also welcoming Ashley Bulak to the HKPR team as the new manager for communications and IT services. She joins us from the town of Cobourg, so is quite familiar with HKPR jurisdiction, and we're very excited to have her join the team. So you might see more of Ashley through these sessions in the upcoming weeks, but we wanted to ensure that our media partners were aware as your key partners with our communications team. So thank you, Chandra, and welcome to Ashley. And so I will stop there and pass over to you, Bill, and happy to answer any questions.
Thanks, Dr. Bocking, as usual, for those comments, and we certainly do welcome Ashley. Some of the Lakeshore media may be very familiar with her in her time from the town of Cobourg, and also just to echo those comments about Chandra. She's certainly been a great manager, mentor, and friend, and continued success with her she enters a new chapter of life. Just a quick note that the link to the Eastern Ontario Health Unit video is been shared on the chat box if media wanted to access it. Our first question is from Dan, and Dan, if you wanted to go ahead, please do.
Thanks, Bill and Dr. Bocking, and first off, just want to say congratulations to Chandra on her upcoming retirement. So first off, last week you mentioned about some school vaccination clinics. So just has the health unit received any lists from the boards yet, or on schools to use?
Yeah, so thanks, Dan. So consent forms have gone out to schools, as far as I know, or been distributed out through schools to parents and families. We do have an initial list of schools that we had developed with the school boards, but we're also looking to see what the response is from parents, so we can ensure that we're perhaps going to some of those schools that have a high number of consent forms returned first. So at this point in time, we don't have our confirmed schedule until we get some more of those consent forms back.
Okay, yeah, and some I just want once the Omicron wave officially peaks, just are there plans to for the health unit to possibly ramp up or maybe reprioritize contact tracing, I guess?
Very interesting question, Dan. My understanding is that the province is really reviewing the role of contact tracing with Omicron variant and potential new variants in the future. And so at this point in time, I don't know really what direction for sure it will go. We can continue with some contact tracing. We know in general with any new variant that is going to be much more infectious, similar to Omicron, that it quickly overwhelms any ability to contact trace. So what role does contact tracing play, or where are our energies best spent and our resources best spent to try and slow transmission? So I don't know the exact answer to your question, Dan, but I think that we'll have more information over the next couple of weeks.
Okay, perfect. Thanks.
Thanks, Dan, for that question. We'll turn it over now to Katrina from Global News Peterborough.
Hi, Dr. Bocking.
Hi there.
My first question, and it is a bit of a loaded question, I apologize, but with the newest findings from the Ontario Science Advisory Table about Omicron plateauing and hopefully the worst being behind us, as well as some restrictions being lifted by the province this week, what does that mean when it comes to wearing masks, and how long do you think, how much longer will we be wearing them?
So I know I say good question after every question because they all are good questions. I do not see the mandate for wearing masks easing anytime soon. I think we're still at risk for new variants arising, and there's already been lots of discussion about this new sublineage variant of Omicron. And so I think that mask mandates or directions to be wearing masks indoors are likely to continue for many months to come, because it is one of the kind of first and foremost public health measures that we have to try and prevent or slow transmission from individuals.
Okay, thank you. My next question is about, well, Pfizer asking the FDA to allow COVID-19 vaccines for kids under 5. I know this isn't for Canada yet, this is in the US, but I'm wondering what this means for Canada and our region, and when we could maybe see kids under 5 being vaccinated.
Right. So we've seen with past, I guess, iterations or introduction of new vaccines for COVID-19, where it's introduced in the US or it's submitted to the FDA first. And then as the FDA is starting to look at it, they'll then submit data to Health Canada for review. Sometimes simultaneously as when it's submitted in the US, and sometimes they wait a little bit longer to get a sense of what sort of feedback and recommendations they're getting through the FDA. So I wouldn't be surprised if this month we were looking at some time it being submitted to Health Canada. I think then we don't know for sure how long it would take within Health Canada. Certainly we know with the pediatric or 5 to 11 vaccine, it did take Health Canada longer, not because they were slower, but I think they were ensuring that they were being thorough and had the data they needed to feel that they could approve it safely. So I think those are kind of those first two steps really before we're hearing anything about rollout in Ontario and health unit jurisdictions. I guess that being said, as a little extra, certainly the province has indicated for health units to be aware of this and to even initiate some planning to support this, because we don't know for sure what the turnaround time might be. So should it be submitted to Health Canada sooner rather than later and it receive approval faster, then we'd be in a position to support rollout. But I think most health units are just at very, very preliminary thinking about how we would best do this.
Okay, thank you, Dr. Bocking. And Chandra, congratulations on your retirement, and welcome, Ashley.
Thanks, Katrina, and we certainly echo those comments. Catherine Whitnell from Metroland Media is up next. Go ahead, Catherine.
Yes, this is kind of a follow-up to Katrina's loaded question. Both Ontario and Toronto's top doctors have noted that restrictions may no longer be a viable way of controlling the virus, and have stated that they plan on placing the risk assessment in the hands of the public. In your professional opinion, is this wise? Can we really learn to live with COVID? And if so, how?
So tricky question, because I don't know the absolute answer. I do think that at some point in time, really, we have to learn with COVID. I think that COVID-19 is a type of virus that doesn't go away. And until we have a vaccine that is really 100% effective, available globally, we're not looking at COVID-19 going anywhere anytime soon. We've learned a lot over the last 2 years about the types of public health measures that are effective in slowing or preventing transmission. And I think the reality has become that the new variant is just so infectious that the risks and benefits of the incredibly restrictive public health measures that worked before, well, they do work now to blunt transmission, it's just so infectious that there's very little that absolutely stops transmission. And so I think that it is resulting in a rethink. I think the public and communities are also keenly aware of some of the harms that have been associated with measures such as isolation. And while for shorter periods of time, those seem like feasible things and we see their impact right away, when we've continued on this cycle repeatedly and repeatedly, at some point in time, when does the scale tip? And I think there's lots of different opinions about that, and people's opinions will also be rooted in their own experiences, in their own vulnerability, and in their own tolerance for risk. So from a provincial level, these are really challenging policy decisions, and I think the next couple of months will also help inform what direction we take as we see really what the impact is in terms of transmission of the Omicron variant as we ease restrictions and as vaccination continues to roll out.
Thank you very much, Dr. Bocking.
Do you have a follow-up, Catherine?
I have a second question.
Go ahead.
Well, does only if nobody else has a question.
Go ahead, Catherine. It's okay.
Okay. It may have partially been asked by Dan, but my question is, I've been seeing a lot of, I guess, blowback on Facebook in regards to the in-school vaccination clinics. There's, I don't want to say that it's a spread of misinformation, but there's a number of individuals who are saying that, you know, in Durham region, they're just automatically vaccinating kids, whether they have a permission form or not. Apparently one parent, well, allegedly one parent even ripped up her permission form in front of the teacher the other day. So what if you held a clinic and nobody came? How crucial is it that children 5 to 11 be vaccinated at this time?
Mm-hmm. I think you're right that there is a lot of misinformation out there and a lot of misunderstandings. I can say unequivocally that children 5 to 11 at any vaccine clinics in schools are vaccinated with parental consent. I think that there is a small number of people, really in the big picture here, of very loud individuals that continue to repeat and spread the same misinformation that we've seen actually with other vaccine preventable diseases before and other school-based programs before. I think what's really key for parents is that they're accessing accurate information and they understand what's happening. Our intent is to offer clinics in schools once we know really the number of students whose parents have consented. So we won't be going to a school to hold a clinic if there have been no consent forms received. So if there's a very small number, we'll be evaluating whether or not it makes sense to actually hold a clinic or whether or not we contact those families individually and try and ensure that they have access to an appointment or the vaccine. But really the hope is and the intent is that there is a pocket of families and parents, and we hope that it's somewhat large, that want their kids to be vaccinated that just haven't had the opportunity yet. And it's easier to do that through school-based clinics. And I think there was a second part of your question and I can't remember what it is.
Oh, how crucial is it that 5 to 11 children be vaccinated?
So I think that there's a couple of different ways to look at it. So the first is what's the benefit for the child? We know that the risk of severe outcomes from COVID-19 is less for children, so it's a lower risk. We know that that risk is not zero. There have been children that have been admitted to hospital, admitted to ICUs, and a very, very small number of deaths. So it's the risk is lower than certainly if you're older, but it's not zero. So there is benefit for that individual child in receiving the vaccine. The second is the community level benefits in helping to protect individuals that are vulnerable and aren't getting the full benefit of vaccines because of age or other medical conditions. The vaccines just aren't as protective for those individuals. And so we know that the same as adults, children can get COVID-19 infection, they can pass it on, that at a community level, the more people vaccinated, the less transmission we do have, and then we'll start to see overall less virus. And so I think there they also play a key role in helping overall our community be well and prevent COVID-19 transmission.
Thanks. Thanks, Catherine, for that question. We're going to go to Dan again for a new set of questions. Go ahead, Dan.
Thanks. Yeah, so just speaking of some very loud individuals recently, what was your reaction to the trucker convoy protests, and what is your message to those in the area who have been taking part and are feeling frustrated by vaccine mandates? Jess?
I think it's fair to be frustrated. I think that the pandemic overall has caused lots of frustration with many individuals and impacted people in lots of different ways. And so there are many people whose livelihoods have been impacted, and in ways that will take a long time to overcome. I think I respect the right of people to protest and share their opinions. I don't believe that some of the really disappointing signs and behaviors that have been reported from some protesters in Ottawa, I don't believe that reflects all of the protesters, but it is really concerning to see some of the rhetoric and some of the slogans that protesters are sharing, which are completely misinformation, harmful. It is never okay to compare a vaccine mandate to genocide. And I think some of those messages are really problematic. So I know they're not reflective of everybody, but I think sometimes as I've been reminded by other folks that intent doesn't always, your impact is sometimes different from what your intent is. So I'm hopeful that there's a resolution soon, especially for those folks that are living in Ottawa.
I guess to follow up on that, is it frustrating on your side to still be hearing this kind of rhetoric being used regarding vaccines?
I think that it will always be there. I think we've learned with previous vaccine preventable diseases that there will always be individuals that don't support the science or that have alternative sorry, I'm having a mind blank, alternative understandings or sorry, I'm blanking on the word. So I think we can expect there to always be people that oppose any sort of restrictions in the name of public health. I think that, the COVID pandemic has stretched all of us, but without public health restrictions, without vaccines, I cannot imagine what the impact would have been on communities. And so I really want to thank and emphasize really all of the good work that has happened and all of those community members that have supported restrictions, supported vaccination, because by far that's the majority of our communities. This is a small proportion of people, very small relative to our overall population, that are expressing their frustration right now.
Well said, thanks.
Well said indeed. Is there any other questions that we have from members of the media? I don't see any hands. I don't see any comments in the chat box. I guess with that, always good information from Dr. Bocking. So thank you again, Dr. Bocking, for your time.